No.
So our next presenter is Dr. Ajay Arora. He's going to present a novel device for subretinal injections. Dr. Ajay.
Hi, I'm presenting a novel system for injection into the subretinal space. The interest in subretinal injections has increased because gene therapy, cell therapy, and drugs can be injected in the subretinal space using subretinal cannulas of 38 to 41 gauge. This can be done by the surgeon by pushing the plunger or by assistant pushing the plunger or using a VFI system as has been developed by Med1. I'm presenting this novel system in a case of a massive subretinal hemorrhage, and I'll demonstrate the utility of this system. So there is an adapter to which is connected a tuberculin syringe and a 10cc syringe. You can see the adapter here. The tuberculin syringe, which has been loaded with TPA, is put into and fixed with the adapter. Now the 10cc syringe, which is connected on one side to the vitrectomy system, to the VFI, is connected and loaded onto the adapter. Here the bush of the 10cc syringe will push the plunger of the tuberculin syringe, which will drive the drug into the eye. The system is primed. You can see the system being primed. The air is removed. You can see the TPA which has come to the tip. We enter the eye, and as I go inside the eye, you can see that there is a change in the reflex the moment I enter into the subretinal space. You can see the change of reflex now, and then the drug is injected. Same step is taken at another site and the drug is injected. This is the post-injection picture where the subretinal heme has been removed and the patient's visual acuity is improved. So the Med1 device is expensive, it's a single-use device, disposable, generates a lot of plastic, while this novel device is cheap, does not generate a lot of waste, and is autoclavable. We have now 3D printed the device, and it's autoclavable softer material, and it is very useful for subretinal injections. Thank you.
How much learning curve does it require? What is the level of expertise required for this procedure?
Sorry?
Level of expertise required to do this?
Level of?
Expertise.
Ma'am, for anybody who is going to inject a drug or aspirate from the subretinal space has to use a tuberculin syringe and either inject or aspirate. Now here, there is no expertise required. You go into the subretinal space, put a foot switch so there is no handshake. Because there is no handshake, there is no enlargement of the retinal opening. And when we are using a 41 gauge cannula, we don't even laser this opening. So this will be particularly useful for gene therapy. If you're going to inject genes below the retina, it will be particularly useful for taking samples, especially in cases of ocular lymphomas where you want to take a sample from the subretinal space. So till now, people used to take a tuberculin syringe, connect a 41 gauge needle and aspirate. So when I aspirate, my hands will shake, I will enlarge the opening, and if you are injecting the gene, you will be injecting it into vitreous cavity when it has to go to the subretinal space. With this, you can inject it inside. So I wanted to highlight, this is a metallic device, or now we have made a softer material. We use a tuberculin syringe. The Med1 device, which is now becoming available in India, it's a single-use, large plastic, lot of plastic waste. This hardly has any plastic waste. Both use 41 gauge needle, which we have to get anyway, and otherwise it brings down the cost dramatically.
Great, very nice.